I would like to call the meeting to order at 6:33.
I second the motion.
Or does she have to motion it? Or do I motion?
You're fine on just starting the meeting.
All right.
That's A-okay.
All right.
When it comes to two. Meeting is now official. It's,
All right.
Okay.
All
It's
right.
been motioned and re-motioned.
So, I appreciate you acknowledging the passing of Kathy Drynan.
Terrible.
I know, I'm guessing you saw it online as well, so.
Awful.
Yeah, Kathy was highly respected, especially for her kindness and her job ability.
Yeah, yeah.
Well qualified, knew what she was doing, and
Yeah.
boy, I'll tell you, was a valuable resource to not only this town, but so many other towns.
Yeah,
So she's going to be greatly missed.
no, there was a wonderful write-up on her.
Terrific
So
human being.
surprised. Yeah, it's awful, especially this time of year.
It's terrible.
Okay, so next is the disposal works permits.
So 3 and 7 Beechwood Road and 127 Beechwood Road, I'm still waiting on revisions. So we'll carry those over to the next meeting.
Okay.
And I'll approve them if they're approved by the review engineer. And we'll just ratify them at that point in time.
Sure.
Okay.
Okay. Discussion items, the tobacco smoke shop.
We've already discussed tobacco smoke shop together. There's been a change in potential ownership, so I asked him to come in, meet the board, and he's not here. So, but he has been in touch with me. I met with him, told him what we expect, gave him everything that we expect, and he will have a meeting with us before they do open.
Okay. That sounds good. Next is the nursing contract update.
I've put together a letter that would cancel the contract that we currently have with the nurse. So there's a letter there for your review,
Yeah.
and I can start the process as soon as we have signatures to...
The only thing I look at on here is it says that we'll terminate the contract on February 17th, 2021. Is that a
Right.
typo?
No, what happens is she has to be given a 6-month notice according to the contract.
No, but it should say
2022.
22. That can be revised.
Okay.
Absolutely.
I
Thank
was like,
you,
wait a minute, that
Candace.
doesn't make sense.
Right.
Yep.
Okay.
So I'll revise that, and then
Okay.
if we could get, we'll just have to sign it. Just at your convenience, or whenever you could stop in, or I could email it, so that way we can get it in the mail as soon as possible.
Right.
Yeah.
Okay. Yeah, if you want to if you just send out an email when it's ready, I can
Yep.
buzz in whenever.
Yeah. Same.
That would be fine?
Yeah.
Okay.
Actually, if you
So-
want, I could do it. You could even swing by tomorrow. Tomorrow Thursdays are my day off, so if you
That's
fix
right.
that real quick, I'll swing by tomorrow. That'd be easy.
It's on my desktop, done.
Okay. Perfect.
Awesome. Okay.
Thank you.
Yeah.
Next is the admin report. All 2022 rubbish haulers permit applications.
Yep.
Yep.
The courtesy reminders went out on the 7th, and Peggy is currently working on the 2023 budget.
Okay. All right.
That budget's actually ready. I have a meeting at 1 o'clock on Monday with the Finance Committee, and they'll give me any recommendations. I think I provided a copy if anybody wants to review it. We're going level funding, which,
Right.
even with the extra demands upon the health department, we'll do it levelly.
Sounds good. Okay, agent report, COVID update.
Always start off with a 2-week run rate, which was 9.95 and then 10.08. it's not uncharacteristic of the towns that are around us. What I've been finding, at least through, now that I'm doing the contact tracing, all of it personally, the cases are far less severe than they were with the first wave of our pandemic. So the numbers are up, yes, but you have to look at both sides of the story
right.
here.
Absolutely.
Hospitalizations are down, at least in this area.
Yep.
Actually, none in this area.
Oh, good.
And deaths are none in this area.
Great.
So, whether it's a combination of people building up their own natural immunity, vaccination, there's a lot of factors that play into it as to why at least it's not as, symptoms aren't as bad.
Yep.
So, there's a plus and minus.
Yeah.
This is the same balance and scale that we're always on. But even though the numbers are high, don't look at it as total doom and gloom.
No,
Yeah.
I agree.
But I would still say caution over the holidays
Yeah.
is great, which sort of leads us into number 2, which is our at-home test initiative. Halifax was rewarded from the state 1,050 test kits. Each kit contains 2 tests. Hopeful delivery date is Friday. So we would put out a message to the community. I've already been working with the fire chief on this, that between the hours of 10 and 3, either the Board of Health office or the fire station would be available to pass out
To the
test kits.
asymptomatic.
Asymptomatic.
Because we don't want people who are sick coming in here looking for a test. Your whole town hall will be
So,
sick.
Exactly. So part of that is, if you are symptomatic, the fire department will allow you to drive up and they will deliver it to your car. But you will not be able to come
into
into
town hall.
either building
Yeah.
Right.
if you have any symptoms at all. Being a community of 8,000 with 1,000 test kits, it will pretty much be on a first come, first served basis.
Right.
We plan on limiting it to 2 per household,
So 2 kids?
2 kits, which would
Okay.
give somebody 4 tests.
Yep.
It's for Halifax residents only, because that's how the state designated
Sure.
things. So we would ask for proof of ID, and we will just track addresses. We don't want people's names, all we want to know is that they're not double dipping all at the same address or somebody. So, seems to be the fairest, most equitable way to give it to people. I mean, I
Yeah.
can't, put children in front of elderly in front of the, I mean, it all depends, I think, upon what do you do for social activity? And that's what the state's goal is saying, we know that gatherings are going to increase. Some people don't go out at all for the holidays.
Yeah.
A lot of other people get together a lot. At least this gives them the opportunity to
Test.
get a little jump on things. And
Yeah.
the test is super easy to do,
Yeah.
and it's read in 15 minutes.
Oh, okay.
Yep. It doesn't count for travel, doesn't
Right,
count
right.
for, just gives you a nice rapid test that says, you know something,
Right.
99% chance that you are infected. And hopefully, in January, they'll have another round just for people to be able to have on board, because right now it's almost impossible to even get a test kit to pay for them.
Sure, right.
And
I've
buy
heard
them.
that, yeah, like at CVS or whatever.
Yeah, so I think that's a, step in the right direction. They're
Right.
getting $2.5 million worth of tests out into the state.
Right. Do we need to, I don't know, do we need to think about any elderly people who
I know, I was thinking that,
Like,
should we
offered
offer to them
drop 'em
first?
off, or-
Yeah.
Well, it would be no problem to drop them off. Again,
I'm just saying, if we
Who's
put it out
first?
there and someone calls, right, and says, oh, I'd like one, but I can't, I
if
don't
I
have
had
a
to
ride,
go for it, I
right,
would do
whatever.
it, yeah.
I mean, I have no problem
As long
dropping
as
off
they were one
well.
of the first ones to call, too.
Yeah, yeah.
I'd have to, because if we just start a list of people who are calling,
Yeah,
And the other
it'd be
question is
delivering
how are we
everybody.
getting this information out? Like, how will,
well, right now it's going to be the town website for sure. But if we did a reverse 911, which is a possibility,
I'm just worried
depends
about
on
our
the
elderly
impact of
community.
what kind of mob you're going to get.
I know.
If you do Facebook, so that's sort of what I wanted to kick by you, because
Because I just worry that like our seniors are not all on the town website. But then I agree that if you do a reverse 911, you're gonna get a way more demand than we have supply.
I think the website, and then maybe like you were saying, Facebook, because I know many people in the
Mobile home
mobile home,
are on there.
they read it. They might not comment or anything, but
They're on there.
yeah, when
Okay.
I've spoken to people, they all read it, so.
but are those people going to be out and about too?
Yeah.
Meaning,
Right.
so if I home deliver to somebody, the chances of that, well, obviously that person is not going out to gatherings.
Yeah,
So the person who goes to their house should be responsible.
right.
So technically,
It should be the person.
they really
who
shouldn't
does.
be chewing up the tests
True,
for,
yep.
for other
yep.
people. And I mean, I certainly always put children and seniors ahead of everybody else.
Right, right.
But we also have to,
Yeah.
say, well, geez, should all be 22-year-olds that get the test kit.
Yeah, well, anybody who
If-
might be going to a grandparent's house.
Right.
And they want to make sure they're safe.
That's the
before they
thing.
go, yeah.
So it'd be better off if Sally, who goes to visit the mobile home
Sure,
person,
sure.
tested before she got there.
Yeah.
It would offer them that opportunity.
Right.
And they might be coming from a different town, and they get their test already over, from a different town.
Right, right.
So yeah, it's tough, but, so Facebook and
The website.
the
I think.
website seem to be, I think, the two best
Yep.
approaches to it.
Do
And
we
we
think
will
we
tell
should
them
put
that
it-
it's a limited supply.
Yep.
And
Should we, I don't know what you think, about the sign out in front of the fire department?
I was thinking that too.
Me too, and Chief also, but such a limited
Amount.
number of characters. You can only play with 16 or 17 letters.
Oh,
So
that's tough. What are
you
gonna-
could, if either of you can dream up a 17-letter message, and don't forget, when you drive by that thing, if it's really longer than a few words, you miss
Right.
it. If you
Yeah.
don't hit it at the right time, you miss it. So, yes, if I didn't think they'd be gone like this, I'd leave it up on there, or,
Yeah.
but that one, or at least available today 10 to 3 on the days that
Yep,
that we have them.
yep,
We could do that. Available today 10 to 3,
yep.
free test kit. Something like that would be okay,
Yeah.
I think.
I think people would assume what kind of test kit we were talking about, like if you
Well, you
put,
can do, if you do the at symbol, like at home
Yep.
test,
Mhm.
maybe.
I would, I'll dream up roughly what I just said and just email it off, and
Okay,
we'll talk to the chief too and
yep.
see what his thoughts are, because, two of us just, he doesn't move if I don't move, and I don't move if he doesn't
Right.
move, so we'll hash it out. And I did also speak with Darlene from Council on Aging,
Okay.
just so that,
She's aware.
she was aware,
Yeah. Okay,
cool.
sounds good. Next up is annual report.
So every year, the board, well, the agent puts out the annual report of what the health department did.
Yep.
I'm working on this year's, should be done, no problem. If you guys have any thoughts or ideas since you've been on the board, I'll certainly thank the former board members, which would be, John Weber and Alan Diaz. Probably mention the passing of Kathy, and also welcome the new members of the board. So that's just to give you an FYI and to let you know if you have any input.
Okay.
Feel free. I can insert and go from there. But it's pretty standard. If you look at last year's, I'm going to give all the numbers. It's all about numbers. How many
Right.
COVID cases, how many infectious diseases, beach tests, Title V's, the whole 9 yards.
Okay. All right. Sounds good. And then the Public Health Excellence Grant Program for Shared Services?
So, the grant proposal has been sent out, has not been accepted nor denied by the state yet. But in the event that it does get accepted, one town health agent has to serve as the head of the 5 towns.
Okay.
Well, the health agent who's going to be doing that is your health agent, me. So,
Nice.
what will happen is, if we get the grant, the town will be awarded the money. And I'll be responsible for paying the services that are going to come through the grant from the towns. So the towns would submit their invoices on our public health nurse. We'll be looking for a behavioral specialist and a inspector, because a lot of the other towns are struggling with what they're doing with COVID right now. They're not getting their food inspections done. They're not getting the Title V's the way they need to. So those were the 3 areas that they were going to grant us money towards.
Okay.
So as I oversee that, once a quarter I have to attend a meeting, whether it's on Zoom. I'll have to write reports that substantiate that the money's being spent for the grant is being spent appropriately,
Okay.
or isn't being spent, and why towns aren't utilizing the monies. So I'll be spearheading that. It also comes with a stipend pay for me doing it, which gets paid out of the grant, not
Nice.
through the town.
Okay.
So it's a proportion of whatever the grant money is. So, but it could be, and well, of that money too. So I'll just pick a figure, $15,000 for the year. That wouldn't just be Bob gets $15,000.
Right.
If I need accounting services, that can be paid as part of that.
Right.
If I need administrative help, Kelly, Peggy, would be paid out of that. Will not take away from our regular work hours. So this is in addition to
Okay.
whatever we currently do.
Yep.
But at least the funding is there to also support what has to be done to make sure that the monies are done so that we can get the monies for the next year.
Right.
And some of the other towns can't do it because they're union. My job is a union job,
Oh, okay.
and that would be a conflict.
Yep.
And then the other towns just didn't want to do it. So if you,
So you're the lucky guy.
well, if somebody didn't step up, it's like
There's
saying,
nobody to
okay,
get it."
here, we want to give you money, but
But we have no one to manage it.
we have nobody to manage it. So, I mean,
At least we'll know what's going on with it.
well,
Inside
that's
source.
sort of kind of what I thought. I spoke to the interim town manager and Sandy from accounting, because she's going to have to cut checks. She said, no, really, that's not going to be a burden on her department as long as I verify the payroll end of things.
Yeah.
And fortunately, we don't have to support like an office for somebody.
Right.
One of the other towns could do that, or if need be, or they might work from home.
Right.
Excuse me. So that's what's happening with the grant, my grant. No.
Do you have any idea when you'll know if it's been accepted or denied, or?
They said sometime after the first of the year.
Okay.
Cool.
Okay. Next we have some
Can we-
items to affirm.
Can we do that with just the two of us?
I think so.
Okay.
Yeah. All right, so I move to affirm expense account 01-512 fiscal year 22-07 for Robert Valerie, clothing reimbursement, vest, and mileage reimbursement.
Second?
All in favor?
Aye.
Aye. Expense account 01-512 fiscal year 22-09 Robert Bucher and Sons Clean Community Services kitchen inspections.
Second?
All in favor?
Aye.
Aye.
He did a great job, by the way.
Oh, great. Good. iPad gift account 26-514-4830-02 fiscal year 22-01 AT&T mobile cell iPad usage contract.
Second?
All in favor?
Aye.
Aye. All right, so we did the stuff is signed, so just the meeting minutes. We sign
Yep,
and vote
sign
to
the meeting
approve.
minutes.
So I move to approve the meeting minutes from December 1st, 2021.
Second?
All in favor?
Aye.
Do the same for these expenses?
Yep.
Okay, expense account, I move to approve expense account 01-512 fiscal year 22, Robert Valerie reimbursement.
Second?
All in favor?
Aye.
And revolving account 25-513 fiscal year 22, Spath Engineering plan review for 03 and 07 Beechwood Road and 127 Beechwood Road.
Second?
All in favor?
Aye.
Aye. And let's see, do we need to approve these?
Yeah, these were all the 2022 food and/or installer and/or rubbish hauler permits. So pretty much if you just read off each establishment to ensure that there wouldn't be any kind of conflict of interest, with any of them.
Yep.
then You're all set, and you could approve 1 through 16. After you just read the name of each one that's getting their 2022 license renewed.
Okay. So I'll move to approve the permits for Tiga Lynn's Salon and Day Spa, Dee's Grill 58, Halifax Cigar and Smoke, Halifax Mobile Station, Joni Macaroni's, Lionville Tavern, Mia's Dairy Bar, Santoro's Pizza, PJ Rubbish, All Town Inc., United Site Services Northeast Inc., Jeffrey Dubord, Cloud Dubord and Son Inc., Robert Morissette On Grade Excavating, Dandel Construction, C. Allen Sating Construction, and William Conley Zenith Consulting Engineers LLC.
Second?
All in favor?
Aye.
Aye.
Should be what we need to do.
All right. Close meeting. I move to close the meeting at 6:57 PM.
Second?
All in favor?
Aye.
Aye.